colleagues, dear friends, it's my big pleasure and honor to tell you my understanding of diabetes technologies and future perspective in diabetes care in days around World Diabetes Day. Why it's so important to discuss it? Because lives of our patients are differentiated from the life before. And before, children with type 1 diabetes, which was a very fatal disease, died. And now our patients live their personal lives, happy lives. Why? Because they have not only insulin treatment, but also technologies. And as the idea of poster told us, life-saving care is a right, not privilege, with education, medicines, and technologies. And so for next 20 minutes, we will discuss with us shortly situations with technologies in diabetes care, and I will tell you some thoughts about future of diabetes care. Let's start from the understanding that for now, goals of diabetes treatments are not only fear of hypoglycemia and no hypoglycemia with decreasing amount of them, not only target glucose level and HbA1c level, not only life of our patients without any chronic complications, but also an increasing of quality of life. And of course, it's only possible to have the increasing level of diabetes care with technologies. Most of these technologies are around blood glucose level and insulin. So what are they? Retrospective or blinded continuous glucose monitoring systems, real-time or personal continuous glucose monitoring system, flash glucose monitoring, smart pens, insulin pumps, sensor-augmented pump therapy, closed loop, artificial pancreas, and a lot of things around blood glucose level and insulin. But you can't just think that that's enough, because there are a lot of technologies which are around diabetes care, but not include in this care of blood glucose level and insulin, because we also work with mobile applications, telemedicine, social media, internet resources, with big data and registries in diabetes care, about artificial and assisted reproductive technologies, and about all diagnostic technologies. So let's start to discuss some of them. Why? Because if we will go through past, present, and future of diabetes care, of course, we will find here all this data around human insulin first implementation, about recommended human insulin approved, about all analogs of insulin here, pramlintide, even inhaled insulin approved, about all these long insulin analogs and other medications. But also here in the future, there are a lot of things which are going through all technologies and diabetes, not only about these devices, but also about some technologies around insulin. And the first future technology which I want to discuss with you, it's smart insulin technology. As an example, I will show you this hypoxia-mediated response of insulin when the glucose level will influence on the action of insulin which will be going through the patient. What about insulin pumps? Because when we just start to talk about technology and diabetes, of course, first thought is about insulin pump or continuous subcutaneous insulin infusion. And of course, for now, there are so many data about this. In this great review, we can just find information that insulin pump therapy appears to be effective and safe in people with type 1 diabetes, regardless of age, for small children, for all pediatric population, for pregnant women, for adults, for everything. And of course, future advancements will include incorporation of closed loop and various decision support system to aid in even improve metabolic control and again quality of life. So what we have now, that we now, for now, we have that insulin pumps uh, have integration to everyday healthcare professionals' life. Of course, when patient enters the office, we just need to understand, does the patient have any device on her or him? And if the question is yes, another question is just very simple understanding, has it been uploaded to the cloud with yes or no? And if the answer is yes, of course, we need to download all information from the device and to use it for the patient caring. And of course, for now, we can just use it not only for treatment, but also for education of our patient and follow-up. And all our healthcare professional offices must be structured to allow for the downloading of devices, so data can easily access it for interpretation by the provider. We just need to think about not only how to use tables and chairs and everything in our office, but also about all the possibility for downloading information from the devices for our patients. Now we have recommendations for all situations with the using of insulin pumps, with all medical conditions. And these types of applications we now have for our COVID-19 era, and it's very important to use it, because even if the patient have altered metastatus, confusion, or unresponsive, for now we just know even without any experience with insulin pump, we know we need to stop insulin pump and switch to MDI. What about acute kidney injury? Of course, we need to decrease basal and bolus settings. What about nursing by mouth, NPO, decrease basal rate, decrease appetite or change in dietary habits, decrease basal and bolus settings? What about steroid use? Decrease insulin sensitivity factor and consider expert consultation or stopping the pump. What about weakness or impaired vision or head strength? We need to evaluate pump self-management skills, and it's also true for narcotic or anesthetic use. So for all this medical situation, we can have an answer from guidelines for now, because insulin pump are not only devices from the future. Insulin pumps now, they're part of our lives and as healthcare professional in diabetes care. We also have a lot of publication now confirming that we can use insulin pump during a lot of inpatients imaging studies and procedures, for X-rays, for bone density, for ultrasound, for CT scan, MRI, PET, high-frequency electrical heat treatment, colonoscopy, cardiac catheterization, or even pacemaker. And for all these ways of treatment, of diagnostic procedures, now we know how we can use these diabetes technologies. So it's, again, it's a story not about the future, but about our everyday life. The next step in the development of technologies in diabetes is hybrid closed loop system. And for now, we have not only one such system, but some of them. And here we can just look through and understand that we can compare different systems with one each other. And of course, this movement, which is called We Are Not Waiting, with do-it-yourself system, connect an insulin pump and continuous glucose monitoring system, and it's possible to understand how we can use it with all these things which are written here, like pump, software, or some things around continuous glucose monitoring. And again, there are so many systems which our patients know, and we all, again, we are, as healthcare professionals, we also need to understand what's going on with the system, because there is a huge amount of them. And I just want again to repeat that, of course, all these insulin pump things are very important, not only because their importance, and not only because they're closest to physiological way of insulin delivery, but also because of high quality of life outcomes for our patients. What about closed loop control? It's very important to understand that closed loop systems are not only safe, like written here in this result of this brilliant paper, but also from the conception of time and range, it also very popular, and it's possible to use as an improving case for improving control of diabetes in terms of target and range. What about continuous glucose monitoring? Again, there are some publications for last years about reduction of diabetes ketoacidosis. Again, about advantages of using these technologies in pregnancy for our patients with diabetes. And again, the first answer for improving control of diabetes during pregnancy is continuous glucose monitoring system, not insulin pump. And of course, if you're going through these numbers with perfect control during continuous monitoring system, and it's written here, thank you, in Russian, because my patients sent it to me. And of course, now we understand again that continuous glucose monitoring system are not the future, but it's our present time, and we need to use it. As a short conclusion here, I just want to say that continuous glucose monitoring and insulin pump in all possible combinations are an important part of our practice. What about telemedicine? Of course, there are a lot of components of these telemedicine systems now, and it's a part of diabetes technologies, especially now when we're in COVID-19 era. And what is the advantage? We can use it without patients in our office, and sometimes it's a huge privilege. And of course, again, with possibility to download information and with possibility to use all this recommendation about time and range protocol, we can just look to the download information with continuous glucose monitor and understand what's going on with all these arrows and trends in glucose levels. As an example, I've just shown you the best practice guide for using diabetes technology in pregnancy with all this information, what you should do when you can just look to the changes, errors, and trends in information about diabetes. So advantages and disadvantages of telemedicine here, of course, it's access to quality of care, convenience, cost reductions, with some possible problems with insurance, less personal maybe care, and potential loss of privacy. But I'm sure that we can service. And as a conclusion, individuals should be adequately trained in the use of telemedicine technologies. What about websites? I just want to show one example from Russian situation, because we have this site for Russian-speaking community with even with blogs of our patients with diabetes. And of course, we need to use all these web resources as a part of diabetes technologies for self-education of us as healthcare professionals, and proper web resources in all languages, including, of course, Arabic language, Chinese language, are still needed. So we need to improve this part of diabetes technology. What about big data? It's again the part of technologies in diabetes care, where and when we can use it with digital preservation, data analysis, of course, for diabetes registers, and it's very important for research, for algorithms and guidelines, and usage of big data as a part of diabetes technologies will help us to understand a lot of things about diabetes. And the last part of my talk is about technologies and famous words of Jean-Philippe Assal, who said that sufficient doctor looks to the world with the patient's glasses. And here I just want to add that it's impossible to understand everything about technology and sufficient use of technology in diabetes care without understanding that human factors such as fear of hypoglycemia, numeracy literacy, data overload, excessive time requirements, technology literacy, device compatibility can influence on the quality of usage of all devices in diabetes care. Why? Because the person behind the number is the main person, not only numbers, because if you're just going through here and understand what's going on in a diabetic's head, there are a lot of thoughts not about numbers and glucose level and HbA1c level and so on and so forth. So again, what is the goal? The main goal is a quality of life. And we need to understand that all these things about treatment of diabetes and technologies and diabetes, and even future with new oral agents, things for insulin injections, insulin pump, new insulin analogs, all these future things, they mean nothing without patients' education. And of course, we need to remember about the person behind the numbers and continuous education in all possible way, including social media, web resources, structural education during hospitalizations, during the usage of any technology in diabetes care. Of course, our dreams about diabetes technologies are understandable, but I'm really sure that if you can dream it, we can do it, as Walt Disney said. And for now, we are living in post-this city and post-Wikipedia era, and the main paradigm in diabetes care is changed. Because before we just was thinking that diabetes is a leading reason for amputations, blindness, chronic kidney disease, and now we can just say that diabetes under control is leading reason for nothing. So with help of all technologies, decreasing the burden of diabetes, not only for patients, but also for healthcare professionals. And the main take-home message in this small talk, due to World Diabetes Day, I just want to say that, of course, we can use technologies in diabetes care, and we can use it safely with knowledge, optimism, understanding of patients, sorry, and healthcare professional needs, and attention, of course, to patients' educations. Thank you for your attention. And if you need something from my talk, whatever you want, slides or links or all these pictures or all my thoughts, you can write me by mail or on Instagram, on Facebook, everywhere, and I will send you everything without any problems. Thank you for your attention, and let's change the world for our patients with diabetes, because World Diabetes Day is a day when we can need to remember about necessity to work as a team all over the world together to help our patients with diabetes. Thank you.
Hello, Evgenia. Hi. Hello. Can you see me? Okay. أسئلة professors.
I want to ask about the sector. What is the sector of diabetic patients advised to use continuous glucose monitoring? Not all diabetic patients can use it, especially in our countries or economies.
Recent publication tells us that it will be helpful for all people using insulin, because it's not only the way to understand what's going on with blood glucose level, but it's also the way to understand how possible to be in targets when we're talking about target range recommendation. Because we need to remember about 7% of being in this range. So it's only possible to understand are you on target or not to use continuous glucose monitoring. And also another option here is to be more educated in processes during your diabetes treatment. So I think every patient with diabetes can use it, but mostly with those patients who use insulin, not only for type 1 diabetes patients, but also for type 2 when they're treated with insulin. So the amount of information, of course, can be very big. And for some patients, especially for patients with anxiety, it will be a little bit difficult to use it because of overloading of this data. But I think for us as healthcare professionals, it can be very helpful just for trying to educate our patients more properly. So my answer is please use it for your patients as much as possible, because it will be helpful for sure. Another question here is cost effectiveness, and of course for healthcare system it can be very expensive. But when we can just try to compare the always chronic application rate and everything, and of course, for now, there are a lot of studies showing us that usage of continuous glucose monitor can help to prevent all these complications. So again, please use it for your patients because it will help. Any other comments or maybe questions?
Hi, Evgenia.
Professor. Hi.
Good morning. I enjoyed that very much. What about what proportion of your patients are on these on these treatment with insulin pumps? What proportion?
In my country, of course, it depends on insurance and for all country, because our financial situation is depending on the region, because Russia is a huge country, but average number is 30% for patients with type 1 diabetes and maybe 5 to 10% for type 2 diabetes patients treated with insulin. So not much, but it depends on the region. For example, in St. Petersburg, the place where I'm working, children with diabetes have more possibilities to use insulin pump because it's for free for several years for now, because we were fighting for this very hardly. So here is 45% of children with type 1 diabetes and about 35% for adult patients with type 1 diabetes. In all other regions in Russia, the amount of users a little bit less, so from 20 to 30%. But it's also a question not only of insurance, but also of knowledge of our patients. For using all these technologies in a proper way, you need to be educated well enough in these things. So it will not help if you will know all the things, how to use it. So I think the way to increase the number of users, it's also to increase quality of patients' education.
And lastly, what support do the companies give the patients, i.e. if there's problems out of hours, at the weekend, is it the company that help the technical side, or have you got your own technicians?
We working with companies, and they have for our patients 24/7 days per week technical support, not anything about insulin dosage or something like this. It's only about buttons and all these infusion sets and everything. So they help us, but it's only possible to work together, because for usual clinician practical, for doctors, it's not possible to be so involved in all these technical things for all devices, because there are so many devices now. And we are just trying to put all these technical solutions from the pharmacy companies' side, so they help us. Yes, I think it's the only way. Is everything okay? Any other questions from the audience?
Thank you, Professor, for the interesting lecture. I want to ask you about the degree of improvement in time and range for a patient using insulin pump, not A1C. I am talking about time and range. What's the extent of improvement in time and range, and is it related to the type of pump? There is different types of pump with prediction technology, without prediction technology, and so on. So is this improvement related to the type of insulin pump, and what's the extent of improvement? Thank you.
Now, it's very difficult to answer your questions, because you need to understand that we can also only discuss time and range when the patient using continuous glucose monitoring. So it's impossible to divide this factor on HbA1c and time and range from pumps or from CGM. So because it's together. But the recent data telling us that keeping closed loop system working better in not only in time and range, but also in HbA1c level, and all these suspicions from low blood glucose, it also working. So if you need a publication, recent studies on this, you can just write me by email. I can send you all the links for this, because for now in Russia it's not possible, as I told you, to use official commercial closed loop system, because they're not licensed yet. But our patients, for example, using do-it-yourself systems, and the results are very, very impressive. So for me, it's just, but it's also, you're asking about time and range and HbA1c level. But another option here is to discuss quality of life, because all the answers for all questionnaires around closed loop system is around I having my life back. I can sleep in a proper way now. I can live in my life now, because before I was using this system, it was nothing. So you can just need to summarize everything, something from quality of life, something about prevention of chronic complications and HbA1c level, something from time and range things and amount of hypoglycemia. So everything together looks like insulin pumps, especially with closed loop systems, are working in a better way if we will compare with MDI. But also here you need to remember about huge improvement of everything with CGM usage. So it's just all the technologies together are working better.
Yeah. Okay, thank you.
Thank you.
Thank you very much, Dr. Patrakeeva. I'm Shireen Abdelghaffar, Professor of Pediatric Diabetes in Cairo University. Thank you for the elegant lecture. Yes, the technology is making actually a difference, and I want to assure you that police hospitals here in Egypt are offering the insulin pumps for children and adolescents, and now even there is a presidential initiative to offer the pumps for whom they need to children with bad metabolic control. I want to ask you something like, what's the percentage of you are using the real CGM or the flash glucose monitoring? And how do you select for different patients? This patient, I would use the real-time CGM, or this one would use the intermittently scanned flash monitoring? Thank you.
Again, sorry, but it's difficult to answer because we start to include flash monitoring into insurance system just for last 3 months, and before we only using for free only real monitoring. So just from this point of view, I can just tell that around the half of the patients are using both systems. But you know, when it's difficult to say something. I mean, yes or no, because some patients are using flash monitoring with some improvement from the technical side to know all these additional things which is possible to add to the flash monitoring, and they have some sort of real-time monitoring. And I think for now it's 50-50%. So just because children are mostly like flash monitoring because it's a little bit smaller, and Dexcom is not licensed in Russia, so it's possible to only have an unlicensed way. And for free, we only have sensors from Medtronic for last years. I mean, 5 years or even 6 years. So if you're talking about sensor for free, so it's 100% from Medtronic, so real-time monitoring. If you're talking about all amount of children using the continuous glucose monitoring system, it's 50-50 comparing from flash monitoring and real-time. But the amount is huge, and for now, because we are just having several months, as I told you, for free flash monitoring system, the situation with HbA1c are improving in a great way. So I wish you all success in this, and I hope that this initiative, presidential initiative, will be successful too, because it's the only way to improve quality of life of our children with diabetes. And it's very, for me, it's really important to discuss it today because it's. And of course, it will help our patients.
Thank you very much. We really enjoyed your lecture. Thank you.